On December 30th, 2019, while the world slept, a machine quietly flagged something strange happening in Wuhan, China. No human had reported it yet. The World Health Organization wouldn't issue their alert for another 9 days. This isn't science fiction. This actually happened. And the story of how it happened will change how you think about AI forever. Here's what most people believe about AI and disease prediction. Either it's something out of a movie, supercomputers running secret simulations, Minority Report style, or on the flip side, people think it's all marketing nonsense. AI didn't really predict COVID, that's just a headline. Skeptics point out that outbreak warnings happen all the time, and most go nowhere. So how could a piece of software possibly beat the entire World Health Organization? An organization with thousands of doctors, epidemiologists, and government data feeds to the punch. The popular myth goes one of two ways. Either AI is magic, or AI predictions are meaningless noise. Both of these are wrong. And the truth is far more interesting than either. The real story starts decades earlier, in 1994, with something called ProMED-mail. It's not a supercomputer. It's a global email listserv where doctors, vets, and scientists in over 180 countries report unusual disease activity, sometimes just a few sick patients in a rural clinic. Volunteers and moderators, real human experts, scan thousands of these reports daily, looking for patterns that don't fit normal disease activity. Then there's HealthMap, built by a team at Boston Children's Hospital starting in 2006. HealthMap uses automated web scraping algorithms to crawl through news articles, social media posts, government health bulletins, and even local blog posts in dozens of languages, pulling signals from places official health systems often miss. On December 30th, 2019, ProMed published an alert about an undiagnosed pneumonia cluster in Wuhan, based on a report originally shared by a Wuhan-based doctor and amplified through Chinese social media and local news. HealthMap's automated system flagged the same signal around the same time, scraping it from a local news report. The World Health Organization didn't issue its formal statement about the Wuhan cluster until January 9th, 2020. That's a 9 to 10-day gap. Crucially, these systems didn't predict the outbreak in the sense of seeing the future. They detected the earliest available public signal faster than slower, more bureaucratic official channels could verify and confirm it. So where does AI actually come in? HealthMap uses natural language processing, a type of machine learning, to read thousands of articles per hour in multiple languages and classify which ones describe genuine disease events versus, say, a movie review that happens to mention fever. It filters noise from signal at a scale no team of humans could match manually. But here's the catch. These systems generate false positives constantly. Every single day, HealthMap and similar platforms flag dozens of potential outbreaks. Most or nothing. A local flu season, a misreported story, a single unusual case. The AI didn't know COVID-19 would become a pandemic. It just surfaced a signal that human experts later recognized as significant. The intelligence wasn't artificial. It was the combination of machine filtering and human expert judgment. Here's the truly surprising part of this story. The biggest obstacle to early outbreak detection isn't technology, it's politics. These systems have flagged early warnings for outbreaks before and been ignored, downplayed, or suppressed by governments worried about economic or reputational damage. The technology to detect outbreaks early has existed since the 1990s. The bottleneck was never can we know, it's
will anyone act on it in time? In other words, the AI did its job in 2019. The information was public. It was the human systems, political, bureaucratic, diplomatic, that took 9 extra days to respond. So the next time you hear AI predicted the pandemic, remember, the prediction was never the hard part. Acting on it is. If this changed how you think about AI and global health, hit the like button. Every week, I take a widely believed claim about technology, science, or history and dig into what's actually true. Hit subscribe so you don't miss the next one.